Hey everybody, welcome to BFR Tuesday, 1 o'clock, Tuesdays, Central Time. My name is Ed Cara. I am the Director of Education for Smart Tools, the manufacturer of smart cuffs. And I've been doing this BFR Tuesday, almost a little over 2 years, I guess. I'm here to answer any questions. Also try to provide some some information that I find interesting. But I always start these off. We'll go for about 15, 20 minutes max, kind of a lunch and learn type of a thing. I'm between patients, so I don't have a ton of time, but I do like to share, especially when people are asking me questions offline. I figure more people have those questions, so I might as well answer those. So does anybody have any questions for me before I get started? Anything specific? If you do, just put it right into that chat. Up your upper right corner, there should be a chat section that you can drop questions in. And I am happy to answer them best I can. All right, last week, doesn't look like there's any questions, so I'll just move forward. Last week, we were talking about some of the mechanisms behind BFR. And what we were talking about was that there are overlapping mechanisms between high resistance training and BFR and low resistance training. But it's like a scale. If the primary reason with high intensity resistance training, meaning 65 to 90% of 1 rep max lifting, causes hypertrophy and strength, it's because of mechanical tension, the amount of stress on the tissue mechanically. With BFR, we're using light intensity loads. So with light intensity loads, it can't be the high resistance or high tension. It's got to be something else. And what the body is amazing. I mean, it has backup systems to the backup systems. So one of the backup systems is going to be metabolic stress. So metabolic stress is one of the major reasons that hypertrophy and strength happens so quickly with BFR, 3 weeks compared to like 12 to 16 weeks with normal training. And as part of that metabolic stress is type 2 recruitment. We talked about type 2 recruitment, type 2 muscle fiber recruitment last week. So if you missed that, check out my YouTube channel and you can see that I talked about it for a good 25, 30 minutes. Today, what I want to talk about is cellular stress. And cellular stress is, cellular swelling. So cellular swelling is when the muscle fiber or the muscle cell, those are synonyms, muscle fiber, muscle cell, swells with fluid. And so we're going to talk about what is happening and why that causes muscle protein synthesis. So before I do that, I got to grab a cuff. Okay, so I've got a cuff and I put the cuff on. And again, remember, we always put it on as tight as you can before you start inflating. Okay. So when we imagine what's happening here, I've got the cuff on, but I haven't inflated it at all. My arterial flow in is 100%. There's no reason it shouldn't be because there's nothing occluding it. My venous return back to my heart is 100%. So I have 100%. We call that free flow, free, F-R-E-E, flow, F-L-O-W. 100% arterial influx, 100% venous outflow. Everybody should be good with that. Now, I take I take my pump, clip, and I inflate this to my predetermined limb occlusion pressure, percentage of the limb occlusion pressure. Limb occlusion pressure is defined as the minimum amount necessary pressure-wise to occlude arterial flow in and venous return out. So you're occluding both directions. When I find that number, I know for me it's 120 millimeters of mercury. So I'm going to train at typically 50% of that number, 60 millimeters of mercury for my upper extremity. So I'm going to inflate this now to 60 millimeters of mercury. Be good if I close the pump. So I've just reduced or just taken the 60 millimeters of mercury, and now I detach it. At this pressure, it's been determined that I am reducing arterial flow. I'm totally preventing venous return. So any fluid that accumulates in here is going to stop here because the cuff is restricting any fluid out. What happens is that since there's, like, think of a garden hose. Think of this as a garden hose. My arterial flow is dripping. You can even see my arm changing colors right now. Arterial flow is dripping in. Nothing is coming out. So what's going to happen is fluid accumulates distal, further down from the cuff. So that's what we're talking about today. What happens distal to the cuff when we put the pressure on and we're no longer allowing venous return back to the heart. Okay, so I'm going to share my screen and go to my, let's go to my presentation. Okay. Okay, play from current slide. Okay, so here we go. Cellular swelling. Now, again, this was from last week. I mentioned that it's Pearson and Hussein's study that laid this all out, the difference between high-intensity resistance training versus low-intensity resistance training with BFR. High mechanical tension is noted with high-intensity resistance training. Low mechanical tension is noted with low-intensity resistance training. We have a lot of secondary mechanisms. Muscle fiber recruitment was the big one last week that I talked about. And if you notice here, arrows are elevated because fiber recruitment is big in heavy resistance because your body is going to need to increase the load that it's able to tolerate. And so it's going to recruit type 2 fibers faster. Mechanotransduction is elevated in high intensity, but it's down in low intensity with BFR. Muscle damage, again, repair, necessity for repair is high with high intensity resistance training, essentially 0 with low intensity resistance training. Localized hormones, and this is something I'll talk about next week, they're elevated in both. Now here's where we start to get a little bit of a difference. Cellular swelling, elevated here, decreased here. So this is where we're at. What is cellular swelling? So if we look at this A right here, oops, sorry. If we look at column A, what is this? This is the cuff, just like I just showed you on my upper limb. We have venous return at 100%. We have, gosh darn it, we have arterial flow at 100%. So these arrows are its normal size. That's the normal amount of flow in and out of the limb. The cuff is not inflated, so this is free flow. And what happens down here is homeostasis. I have the normal pressure outside equal to the pressure inside. Remember, our body's always trying to equalize. So pressure on the outside is equal to the pressure on the inside. In B, now I inflate the cuff to a certain percentage of my limb occlusion pressure. In the upper extremity, that's somewhere between 40 and 50% LOP. In the lower extremity, it's between 60 and 80% LOP. When I do that, I've got a little trickle in of arterial blood flow. I have 0 venous return. So what happens? Fluid is accumulating. Fluid is accumulating outside of the cell. In C, what's happening is over time, this fluid starts to push into the muscle. There's still a little bit of arterial flow, but because there's extra fluid on the outside, eventually your body has to normalize and will start to push fluid into the cell. So that is cellular swelling. Now, why does that matter? Oops, I didn't even get into it, but let me stop sharing. The reason that that matters is as the cell is getting bigger and bigger and bigger, the cell thinks that it's going to break. So it's preparing for that rupture of the cell or apoptosis. If that cell breaks, what does the body have to do? It has to replace it. It has to repair that damaged tissue. So you are basically trying to repair tissue that's going to be damaged. But guess what? It never gets damaged. So you're creating muscle protein synthesis without actually causing damage. And so you're laying putty on top of putty. And that's why hypertrophy appears to happen so rapidly. One of the reasons. Next week, I'll talk about some other reasons that it may be, like stem cell production and hormones. But with cellular swelling phenomena, the swelling of the tissue gets to the point where your body thinks it's going to break down, so it starts to regenerate through the process of muscle protein synthesis. Now, it happens osmotically, just from pressure. That was that description of that passive BFR. So with passive BFR, we're not exercising. Fluid just starts accumulating and pushes in with pressure. Some researchers would argue with me and say, and some physicians I know say that it only occurs with exercise, because what happens during exercise is when you create the hypoxic environment with BFR, the acidity levels start to increase in the cell. And if acidity gets too high, the muscle or the fiber will die. So what the body tries to do is push water or fluid into the cell to decrease the acidity level, which is essentially increasing pH, so that it's not so acidic. So you're basically trying to counterbalance exercise acidosis. Now, we know from Lonicki's work that that is not the only time that this happens. Passive BFR is a way to increase muscle protein synthesis. One of the ways that I know this is that when I use it on patients that have a cast on their arm, they're in a brace and they're immobilized, we prevent muscle loss without exercise. There has to be a mechanism that's happening, and I believe that mechanism is the cellular swelling phenomenon. Now, when we do the cellular swelling protocol, the protocol is 5 minutes of passive BFR at, I'm going to put 50 or 80%, 50 or 80% LOP, 50% in the upper extremity, 80% in the lower extremity. I tend to keep these pressures high. Then we take a 3-minute rest, meaning I deflate the cuffs to allow for blood flow to go back in, and then I reinflate the cuffs. So we do 5 rounds of 5 minutes on, 3 minutes off. Some people call this the 5x5 protocol, otherwise termed the cellular swelling protocol. Now, Dr. Lonicki down at University of Mississippi has done some studies looking at muscle protein synthesis and the cellular swelling phenomena. And what he found is that if you only do 2 rounds, you don't get muscle protein synthesis. So you can't cheat the system. You need to do 4 to 5 rounds. That's the only way that you're going to get that type of adaptation effect. And I just think it's 2 rounds is not enough to swell the cells enough. The second thing to remember with cellular swelling phenomena is that if we add electric stim, neuromuscular electrical muscle stimulation, we can create contraction of the muscle, so you're getting mechanical tension in addition to cellular swelling. So you're going to get muscle protein synthesis through the cellular swelling, and you're also going to get growth hormone production. So for healing, that would be key. So the way, depending on who you are and what you're trying to do, if I have somebody that has a cast on and I want to help improve their bone healing, I want growth hormone production because we know that growth hormone production helps bone healing. If I have somebody that is trying to repair post-surgically, I would want to produce more growth hormone. So I would put stim on there. I like to use stim anyway because I like muscle tension. I think that you get a better result and you lose less muscle mass. And if you remember Gorgie's study from 2017, he used cellular swelling phenomena with spinal cord injury. We mentioned this a few weeks back when I had Michael on, and using the cellular swelling phenomena with electric stim increased muscle mass of the extensor groups of the forearm by 17% and increased grasp strength. So pretty cool stuff. Any questions about cellular swelling? And I'll look at the questions that are going on, and I'll finish the thing with 5 rounds. So BFR focuses on the appendages. Can BFR have any benefit or approach to work glutes? I'm a newbie, so I hope the question not too fundamental. Frank, not at all. I mean, that's what I'm here for, is to answer these questions. And the answer is yes. So if I put the cuff on, and I'll do it again because I think visual is important. If I put this cuff on, we get benefit distal to the cuff, we get benefit proximal to the cuff, and I get benefit crossover effect. So you get a systemic effect. So if I have somebody that can't lift weights with one arm because, let's say, they just got out of surgery and I can't put the cuff on them, I will have them work with the other arm to get the ghost effect, and that's the crossover effect. So in the glutes, you are going to do like, I will prescribe, let's say, a long arc quad, a hamstring curl, and then I'll finish with a glute bridge. So 2 exercises distal to the cuff, then 1 exercise proximal to the cuff. So I'm going to wear these muscles out. So I put more emphasis on the proximal muscle because the proximal muscle is not going to get as much work as the distal muscle because it's not getting deprived, but it's still much harder. So Frank, try doing glute bridges with the cuffs on, and you'll see what I'm talking about, that you get a major effect in the glute. Hopefully that answers your question. Any other questions regarding cellular swelling or anything in general? Hi, Jen. Okay, so with an untrained individual, is it worth using lower pressures for the cellular swelling protocol, say 50% in the lower extremity if the individual has a higher BMI or is older? I don't find with cellular swelling, if you're doing it passively, it's pretty easy. Like, unless maybe if it's their first session or second session, I could do it a little bit less. In the lower extremity, I would still stick to the 60 to 80%, because I know that those are the effective values. In the upper extremity, 40 to 50%. So I give a range, so you never think like, oh, Cara said it has to be this. It doesn't. 60 to 80, 40 to 50. Those are my, that's not going to be my go-to. And I don't know if it's going to prompt a response or not. My gut is that if you don't prevent enough of this venous occlusion to come, if you allow venous occlusion, then it's not going to do its job, because you're not getting the metabolite accumulation, you're not getting the cellular swelling effect. So I don't think it would be enough, but I don't know. I've never done it that way. Now, this is one of the reasons why these cuffs are very valuable, because I can't do a cellular swelling protocol with cuffs that don't get limb occlusion pressure. And I'm not going to name any companies that don't, but there are ones that use a bladder that's not continuous. So this is a continuous bladder. And so when we inflate this, there's no gaps. And you want to make sure that the cuffs can fully go around the limb and there's no gap. Because otherwise the fluid can just get back, and that's not what we want. We want the fluid accumulation to get the cellular swelling phenomenon. Most of the cuffs that are out there are they allow escape. If you look for a term on their websites called, they don't use the term occlusion. They use the term, I don't know what term they use. I'm sorry. I can't think. It's, but basically look to make sure that you can get limb occlusion pressure. And if you can't, then you're not gonna be able to do the cellular swelling phenomena. It's just, it won't work. And if you email me offline or connect with me offline, I'm happy to answer any questions regarding specific cuffs and things out there. So to summarize, Jen, I don't think at those pressures you're going to get the response you're looking for. Now, if it was me and I inflate the cuffs to somebody and it's too much, doesn't matter what the percentage is. I'm not going to torture somebody and they're at 8 or 9 out of 10 discomfort. What I'm going to do is I'm going to slightly reduce the pressure. I'm going to measure circumferentially, and I'm going to make sure they're getting a swelling effect. So if you pre-measure and then post-measure, and after 5 rounds they've got swelling, then you'd be like, well, the Cara's full of crap because I can get it to happen. Awesome. But try to quantify it so you know you're getting the effect that you want. You don't want to waste your time or their time. Hopefully that helps. Anything else? Any other questions today? It's been 22 minutes. Time flies when you're having fun. Next week, I'll talk about hormones, growth hormone, insulin growth factor. Maybe I'll talk about, I don't know. We'll see what we talk about. Thank you guys very much for joining me. I really appreciate it. You can join our Facebook group, which is BFR Masterclass. I'll put that in here. On that's not, just request it and I'll add you. That's on Facebook. And I hope everybody's well, and I'll see you next week. Thanks.